and I love just seeing the energy and the vibrancy and the way you talk, your smile. You were not there before. And so just to see you talking about this in retrospect, it's so clear to see the shift here. All right. Hello and welcome. This is Dr. Joe Mather, the medical director of the Ruscio Institute for Functional Medicine. And I'm here with one of my favorite people in the whole world, Kyle Fitzgerald. Hello, Kyle.
How you doing, Dr. Joe? Good to see you.
I am so happy to see your face. And I have enjoyed working with you every step of the way. And it's been a little bit of a journey for us. And I wanted you to come share your story because we've been through the trenches together to get you well. And your story is so much fun to share because of where you were when you started. And it took a while, but you are a completely new, vibrant, amazing person. And I'm just so excited for you. And so I want other people to be able to see what can happen when you do good functional medicine and when you have an awesome, compliant patient who is willing to stick in there with the punches and do what it takes to get better. So maybe to start, will you bring us back to when we first started working together, not quite 2 years ago, but maybe 21 months ago? What were you feeling like? What was going on in your life at that point?
Yeah, so really just a lot of stomach pain. And it was that was my main complaint. That was my main symptom. It was just stomach pain with everything I ate, even if it was something healthy, like some chicken and vegetables. It was stomach pain before the meal, during the meal, right after the meal, everything.
Right.
So that was my main problem. And then also constipation, having trouble going to the bathroom, not going often, feeling backed up, bloated. And then with that, I mean, when you're constantly in pain, one, you don't want to do anything. So sitting there on the couch, watching TV, doing whatever, low energy, sometimes headaches and towards the back of the head, just not doing well, to say the least.
Yeah, and the background is that you came into the clinic and you had a history of Crohn's disease, of inflammatory bowel disease, and you previously had an abdominal surgery, still just struggling. I think you were on Remicade, perhaps, but one of the biologics for inflammatory bowel disease. It's still just not well. I remember seeing you in that first visit. You had a guitar in your background and you're talking about how much you love guitar and you're studying for accounting, but you're just not functioning well at all. And so we started you through some treatment, and we'll skip maybe a couple of steps, but some things worked really well for you. Others didn't work as well. Maybe we can start with the things that we've done over the past while that really hit the mark for you and really made a difference. Do you want to share that with?
Yeah. So yeah, for sure. So right away, I think it was after the first time we met, I started all three different strains of the probiotics, the lactobifidobacterium, soil-based, and then Saccharomyces boulardii. So started all three of those, and then right away saw an improvement in digestion, going to the bathroom, a little less abdominal pain with meals and after meals. So that was one of the main things that we started, where I saw a huge improvement in my health.
That's right. And we didn't pay Kyle to say that. This is just what we see all the time in the clinic, is that the combination really makes a big difference. And particularly when their gut is inflamed, when there's leaky gut, when there's intestinal damage, like there was an inflammation with the bowel disease, it just makes a big difference. And from my perspective, that improvement led us to really then go the next step. What else are we missing? And early on, like a lot of my patients who have autoimmune disease, we did find mold toxins positive for you. And so we initiated treatment fairly early on with binders. Do you want to talk about that at all?
Yeah, for sure. And just quickly going back to the probiotics, I wanted to say that I tried a bunch of different other probiotics too. I was familiar with probiotics. I knew what they were, but I hadn't tried these specific ones yet. So I tried a bunch of other brands and strains, but obviously the combination of these three were much more effective.
Yeah.
But yeah, so we tried. So we did the binders initially, and it didn't go so well.
Good. I'm glad you said it. You reacted. You did awful. We were inching our way, trying very small doses. You felt worse. Abdominal pain, I think, got quite bad at one time.
Yeah, it kind of felt like I went backwards, and I was like, oh no, like this is terrible.
Yeah.
But then sure enough, we backed off the binders and we went towards the antihistamines, I think it was, NAC, things like that.
Yeah, we definitely gave you some mast cell and histamine support. From my read, I remember that the Gupta program had helped you get over that hump, and we did that for quite a while. You were really a good patient with that.
Yeah, I'd say if there was one thing out of everything that we've done and worked together, that Gupta program was one of the most important things that you told me about, and that I did. That was honestly life changing.
I feel the same way. I was in a similar place. I'm sure I've shared with you this, is that I was at a point where just a couple drops of bentonite clay that I was taking for my mold toxicity make me into a crazy person. Anxiety and agitation and pain, and you didn't have quite that reaction. You had more severe abdominal pain, and thankfully I never had to deal with that. But we both needed Gupta program to really calm our nervous and immune systems down. And then we were able to get you to a place where we were able to just slowly and steadily watch you improve. That was my recollection. Pretty much from, let's see, go back to the timeline. We started July, and I think that this was kind of by last summer, that you can tolerate and eat. Beginning, I think at this point, to exercise a bit more.
Yep.
Do I have all that right?
Yep, that's all correct. Yep.
Awesome. And we kind of got to the point in the summer where you were still having a little bit of ongoing symptoms. You want to catch everyone up to speed? What happened next?
Yeah, it was kind of like I was seeing this improvement. I was doing better, doing the Gupta program. Digestion was getting better, and then it kind of got to a point where I kind of felt stuck. Like was just at this point where I was feeling good but not great. I knew I could get better. And then I think at that point, I'm trying to think what we did. I'm not sure if we did maybe the low FODMAP diet at that point.
We tried low FODMAP. I have in my cheat sheet here. And by the way, patients, the nice thing about working in this clinic is that we have everything organized, so we can always look back and see what was done, so we don't ask you to do the same thing twice or any other embarrassing things. And we asked you to do a clean out. You actually had a colonoscopy for your regular screening, and that opened things up. We're like, aha.
Yep.
Maybe exactly. We're missing some constipation, right?
Yep, exactly. And then once we got things moving again, everything has kind of been improving since then, and it's honestly still improving to this day. Getting better and better in terms of my digestion and overall health. I had a lot of also this was kind of before the Gupta program. I had a lot of lower back pain too. I guess nerve pain, like down the back of the legs, kind of in the butt, down the legs, lower back. And with the Gupta program, with all that meditation and kind of just being more present. I know it sounds kind of cliche, but it's true. Just being more present, I felt that pain level go way down over the course of a few months.
Which is, it's just so fun to see. And I love just seeing the energy and the vibrancy and the way you talk, your smile. You were not there before. And so just to see you talking about this in retrospect, it's so clear to see the shift here. I almost wish we would have videotaped your first visit.
Yeah, I know, right? It's funny because when we had our last appointment a couple of weeks ago, and we were kind of going over everything I've done, everything I've tried, like I was looking back and I was like, wow, like I was in rough shape 20 months ago, and to see how far we've come is awesome.
I want to go one more medical thing, and then I want you to share with everyone what you've done with your health journey, because it's just so awesome, inspiring, and I love it so much. But we're not going to do that quite yet. We're going to tease it. Okay. The last thing I had you do in February, we go to the point where you're kind of night and day better. Most days you're 75% better than where you were 18 months ago, 21, whatever it was. And so clear, steady improvement. You're living a better life. You're more energetic. You're doing better kind of across the board, but we still have some constipation. I had you do some abdominal massage. And this is something that I wasn't recommending 2 years ago, right?
Mhm.
What's been your response to the abdominal massage?
It's been great. So pretty much, I think I've really only been doing it for maybe a week and a half or so.
Mm-hmm.
Just kind of an all around abdominal massage, but then really focusing on the area that I feel is more tender, kind of where I feel like almost things are getting backed up, really focusing on that area.
Yeah.
And I've seen dramatic improvement in one, bowel movements, but also just less pain than I'm already at a very low level of pain, if at all. But that even better, and just everything is just moving as it should be.
Patients who've had abdominal surgery, particularly when they've had a colectomy, there's a lot of scar tissue that happens when you cut the bowel in half and sew it back together. And things can get stuck. We can have adhesions, right? The scar tissue can prevent the normal flow through it in the colon. And so I suspect that's what's happening, is that you're restoring some of that function either by breaking up the adhesion or just triggering the bowel to just behave itself a little bit better in the presence of that scar. So that's always so much fun to have someone try something and then within a week see a shift. That tells us that it's a sort of intervention that we want to stick with. If you hadn't had that response, then you could have yelled at me right now and we would stop doing it, right? Try something else.
And it was honestly the first day, I think. Like I know the difference.
Nice.
Yeah. So it was almost instantly, which is awesome.
It's just awesome. That's what we're looking for. Simple, easy, and you're better. All right. So I want to highlight you for a minute. Share, you quit your job and now you have a new job. Kyle, what kind of work do you do?
Yeah. So really quick background. In college, I majored in accounting. I did a master's of accounting program. I ended up getting my CPA, studied for all 4 of those tests, did all that, started my accounting job and just wasn't loving it. And here we are now, fast forward about a year since I first started a social media account called Clean Kitchen Nutrition. You should go follow me if you don't already. But basically what I do is I take you all inside of the grocery store, going down the aisles of the grocery store, reading ingredient labels, teaching you what ingredients to look for, what ingredients you do want to put in your body versus what ingredients you should be avoiding. Partly because so you guys don't have to go through what I went through, all these troubles and supplements and diets and all these different things. If you eat real food from the beginning, most likely you're gonna feel
Who knew?
right? So that's what I'm doing now. I'm doing that full time on Instagram, TikTok, and starting on YouTube here shortly. But yeah, it's very exciting. I absolutely love it.
It's so cool that you've put what you've learned into a whole new career, and you're just at this completely different place. And now, how many people do you get to help by just giving such great information? I love it.
Yeah, exactly.
Clean kitchen nutrition.
Yep, it's
so
awesome.
Fantastic.
I love it.
What would you, if you could go back in time to kind of 3 years ago, Kyle? What would you tell him?
I would say stop worrying. At least for me personally, I was such a worrier, whether it's worrying about something that happened in the past or worrying about something that's about to happen in the future. I always just built up more anxiety and worry than I needed to. Mm-hmm. So I'd really say that's the one thing. Take deep breaths. Everything's going to be okay. It sounds cliche, but it's true. Everything's going to be okay. Live in the present moment. Don't worry about too much, and just have fun. I mean, that's why we're here. We're here to have fun. So yeah, that's what I would say.
And Kyle, you've brought a lot of fun to my life because I just love seeing you get better. It's been so inspiring. And so if you are a patient and you are in a rough place and you've got Crohn's disease and abdominal pain and bloating and food sensitivities and no energy, you can get better. Look at Kyle.
There is hope. I promise.
This is awesome. Is there anything else you want to share with a future patient who might be listening? Anything at all?
Not really. The only thing I would say is so before I even met Dr. Joe and joined Dr. Ruscio clinic, I had worked with the previous functional doctor, and I had done a ton of research kind of on my own, trying to figure it out by myself.
Yeah.
But in the end, especially if you're going through something serious like Crohn's or anything really, it's very important to hire a functional practitioner that knows what they're doing, that's treated patients similar to what you're going through might be. And I couldn't recommend you or Dr. Ruscio or anyone else in the clinic enough, and how helpful and inspiring and great you've been over the past 2 years, and honestly for the continuation, because I don't see myself just stopping working with you.
You'll have to put up with me a whole lot less because you're so healthy. You can go enjoy your life, but
exactly.
I'm here when you need me. How does that sound?
Exactly. I love that.
Kyle, thank you. I know this won't be the last time we speak. I'm so proud of the improvement and the growth I've seen. You're just fantastic. And people are going to be really inspired. Just hearing and seeing you is going to inspire a lot of people, I think, to make some good choices for their health. So thank you for doing this.
Yeah, absolutely. Thank you for having me. I appreciate it.
Awesome. All right, bud. I will talk to you real soon, and take care.
Yep. Sounds good.
All right. Bye.
Bye.